Hello, this is Dr. Ray Ramirez from Lakeview Veterinary Clinic, where we're helping your pets live the best life possible for as long as possible. And we're doing a series here on introducing your pets to your home. So we're assuming you've got some resident pets at home. In this case, we're talking about cats. And we're going to talk about introducing an adult cat to our new resident kitty, okay, or kitties that are at home. You may have recognized this kitty from our previous video where he played a kitten. Well, now he's got his new makeup and props on here, so you can see he's an adult cat. Okay, so I knew you could tell that, but just want to make sure. So what we did with our kitten video, you may remember, but that's okay. We're going to go through it again. It'll look very similar, but there's a few little differences that are very important. Okay. So you've got one or more kitties at home, and you're going to be bringing in an adult cat. Maybe it's a family member or a friend who needs you to take care of their kitty, either for a short term or long term. So first thing we want to do is get a separate room with our own food, water, and litter box. Okay? And you want to use this room where it's something where you're going to interact with the new kitty quite regularly. So again, I like a bathroom, because we're in and out of there a lot, or a bedroom. It needs, though, to be something with a door. Okay, we can't be in a great room or something like that where there's no way to separate the new kitty from the resident gang. Okay, so step one, find a room like that, and step two, food, water, and litter box in there. So then we bring the new kitty in and make sure you do have a carrier. Okay, so we bring the new kitty in the carrier, and we have them in their own little room. And so now we keep them in their room. What I would do is open up the door and let them come out on their own. Because again, cats like their own territory and familiarity. Anything new, they get kind of scared. Okay, and it can be more anxiety. And so we're trying to reduce that stress in cat talk, in people talk too. We're trying to reduce that for our kitties. So bring new kitty in, just open the door and let them come out on their own. Okay? And they'll wander around and feel more comfortable. Okay? What you want to do is that door is going to stay closed to the other cats, obviously not to you and the other people in the household, because you want to go in and interact with the kitty, be friendly with them. If there's treats that you know that the kitty likes, use that to encourage him to come out and see you. But we want to continue to do that with the new guy here until he is relaxed. How can you tell that? Well, easiest way to tell is when the cats are laying over on their side, kind of with their belly exposed, relaxed, all stretched out. Okay, if they're sitting kind of in the little meatloaf position like this, they're still kind of nervous about things. They're not completely relaxed. When they're stretched out and relaxed, then you know they're comfortable in the surroundings. And that's what our goal is, to be comfortable in the surroundings. So that's the resident, or the new cat coming in, not the resident cat. So the new cat coming in. We don't open the door at all until new cat is relaxed. The other thing we need, though, so this is a two-parter. The second thing we want is for the resident kitties, they need to be walking by the door and not hissing constantly at the door. Okay? This is similar if you watch the Introducing the New Kitty one. Again, cats don't like new smells, and especially new smells of similar possible, not predators, but similar competitors for food, even though they got more food than they know what to do with, obviously by Plump Kitty here. But they still don't like those competitors, those new things in there. So when the resident cats stop hissing, then we can possibly go to step two. But we need both things. We need resident cats to stop hissing, and new cat being relaxed in his own little space here. Okay? So then we can go to step two. And this is our supervised visitation. We talked about this in the kitty video. But so for supervised visitation, we open the door when you're home, and we allow them to integrate. You don't take new kitty here. You don't take resident kitty here. No, no, no. Let them, on their own terms, do that. Now, as long as you don't give them a gun or a knife, we'll be good. Okay? So just check, make sure new kitty doesn't have a FOID card. But so we do that, okay? And sometimes, and how much of this goes on will really vary by your cats. If new kitty is, hey, I like where I'm hanging out here. I don't need to go anywhere. You open the door and he's like, oh, whatever. That's fine. Resident cats may even be like, ugh, I don't like that smell, but you know what? That's just one room. I'm fine. I've got my little kitty condo over here, and you know, I've got my little perch where they've got for me. I would not put the perch on my laser, CO2 laser for surgery, but that's another story. But so they may be pretty relaxed too, so there may not be as much jumping in and integration at the beginning. Usually there'll be a little bit, and again, as long as they don't have, you know, we were joking about that, but seriously, they'll take their time and kind of integrate. They'll kind of feel each other out, how close is too close, and then whoever thinks it's too close will hiss, and the other person will back away, and we just kind of keep with this little dance until they start laying together and maybe even grooming each other. How long that takes can be quite a while. Okay, so what we do is, let's say we come home and it's time to do supervised visitation. We close up and it's bedtime. Okay, and they really haven't done too much. Maybe new kitties walked around to see, but he comes back. Maybe resident kitties sniffed around to see what's going on there, and he's back in their territory, back in their corners. And it's bedtime. Okay, bedtime. We close the door again, so they're separate. When you're gone during work the next day, we're separate. You can open the door while you're getting ready in the morning, so they can kind of integrate, but make sure they're separate when you're gone and at bedtime. Okay, and we continue to do that until, like I said, they're kind of relaxed and grooming each other, maybe laying together, where you know, okay, this is a relaxed household of kitties. And then we can go to step 3. And step 3 here, that's where we can combine our water dish. Food bowls should probably still be separate, okay? And litter boxes, we always want one more litter box than the number of cats. So in this case, we have 1, 2 cats, so we need 1, 2, 3 litter boxes. The other thing that's really helpful too and really important is every level of your house that the cats have access to, we should have a litter box. So I'm not saying on your cat condo you need a litter box, but if you've got a main floor and an upstairs or a main floor and a basement that you guys are in quite a bit and the kitties have access to, we want a litter box in both areas. Okay, and then you can integrate and we have a lovely, happy household of kitties again. How long this will take will really vary. It can be as short, maybe as a week is probably the shortest I've seen, but that's usually with younger resident kitties. You know, maybe a year, maybe up to 2 years of age. Once they kind of hit that social maturity at about 2 years of age, then as you get older, it just takes more time. It's not that it's impossible. We just have to be more patient so that we have a nice, happy, integrated household. We don't raise too much anxiety to where we have kitties going outside the litter box and things like that because they're very stressed with the situation. So we're trying to minimize that. So again, shortest is a week. I've seen some that takes as long as 3 months before we can stop the supervised visitation. But again, we're patient and we can help our kitties be nice and relaxed so we can help them live the best life possible for as long as possible. So again, this is Dr. Ray Ramirez from Lakeview Veterinary Clinic. If you have questions about things like this, ask your regular veterinarian. And if you don't have a regular veterinarian, we would love to see you at Lakeview. Especially as your kitty gets a little bit more older, obviously my English is not the best, that's why I'm a scientist. But as your kitty gets a little bit older, some of those little, going up and down every time you got to go to the bathroom can be a little bit more of a challenge for our older kitties that are dealing with some arthritis. And so that can be very helpful for them.